Ebola is a virus called the filovirus that lives predominantly in jungles in Africa. In the countries of Guinea, Sierra Leone, and Liberia, there's an unprecedented Ebola outbreak that is continuing to spread and presents a huge humanitarian, economic, and political challenge. It causes civil unrest, and it's causing a large number of infections and a large number of deaths. And the outbreak has proven very, very difficult to control. It's actually requiring a large multinational effort. In the past, Ebola was a disease that would be acquired in the jungle in a very limited geographic area, rural space, and could be controlled easily when healthcare and public health people became aware of it by isolating a few cases. What's happened now is the virus has gotten into urban areas. And in these urban areas, it's spreading very rapidly because people have a lot of contact with one another. There aren't good public health systems to trace the exposed people. The healthcare system isn't able to isolate all the infected people. Many people are staying home, infecting their household members. People who die are being buried in ways that increase the risk of transmission to the community. It's unlikely we will have an outbreak of Ebola in the United States. It'd be very unlikely. We have a very good healthcare system here. We have the ability to track and monitor persons who have Ebola infection, to isolate them, keep them away from other people, and to monitor their contacts. So if their contacts became ill, they also would be isolated, and therefore the opportunities for transmission of the virus from person to person would be very small in the U.S. Ebola is not highly contagious compared to many of the other viruses we are familiar with. It's not as contagious as influenza, as pertussis. Measles is about 10 times more contagious than Ebola. So although Ebola does spread from person to person, it's not highly infectious. It doesn't go through the air like measles does, which is why measles is so much more infectious. Ebola has to have direct contact with individuals to spread. When travelers return to the United States from the affected countries, they need to be monitored. The disease does not spread from people who don't have symptoms. So it's important for folks to understand that by monitoring your health after you return from this country that's been affected for 21 days and reporting immediately the first sign of anything wrong, it could be fever, feeling ill in any way, you then can limit your contact with others and prevent transmission if indeed you do have Ebola. There have been instances where children have been sent home from school, where spouses have been sent home from work because someone in their family has been over in West Africa and helping fight this outbreak. Again, people who are infected with Ebola are not contagious unless they're ill, and anyone who's been to the area who's not sick certainly doesn't pose a risk. Healthcare facilities here in King County have been preparing to an unprecedented degree around Ebola. I've never seen the healthcare community more engaged around any issue since I've come to Seattle. There's been a huge amount that's been learned from the early cases in Dallas. There's a lot of planning that's going on all across the board in every type of healthcare facility. And we've got several healthcare facilities that have made a commitment that they want to become Ebola centers of excellence. In other words, they want to be able to hospitalize and take care of very sick Ebola patients. So they're putting in place a high level of preparedness around infection control, use of personal protective equipment, training staff, laboratory testing, handling environmental waste. And the other facilities that feel like they don't need to develop that level of expertise are still developing the ability to evaluate patients who have Ebola, to appropriately isolate them, to prevent spread in the healthcare facility and in the community. And the most important thing for people to understand is that getting the outbreak in West Africa under control is the best thing that we can do, both to help that global public health emergency and decrease the thousands of deaths that are occurring every week in that area, but also to decrease the risk of Ebola here in the U.S. and other countries. If you're interested in learning more about Ebola, we have a lot of great information on our website at Public Health, Seattle and King County, with links to authoritative and up-to-date information from a variety of good sources.